All right. Thank you so much for participating in the Shut Up or Talk Up Wellness Lifestyle Brand Health Talk Conversation. Today, we have the privilege of speaking to Dr. Ego. And Dr. Ego is a pediatrician that works with the most vulnerable creatures in this world, the babies, the children. Dr. Ego, I just want to say thank you so much for participating. Can you introduce yourself to our audience and let them know a bit about your expertise?
Mentioned, I'm Dr. Ego-Osuala. I'm a primarily an outpatient pediatric physician, but I also work as a pediatric emergency medicine with Johns Hopkins Health System. Lastly, I am a busybody, so I do cover the newborn nursery as well at University of Maryland Cap region.
Oh, wow. That's awesome. That's awesome. And so, um, just out of curiosity, why was pediatric your specialty? What made you go into that specialty?
To be honest, when I went into training, people would describe me as, Dr. Ego-Osuala. He has a short fuse. He doesn't necessarily, you wouldn't think he would ultimately, become a pediatrician or gravitate towards kids. But one thing I gathered during my training was, as I went through my rotations, adults would make you cynical because they become so demanding, they become so entitled, they come in angry, whether if you treat them well or if their situation declines, they tend to always come with some sort of baggage, for lack of a better way to put it. But children is really innocent, genuine. When they tell me they have pain, I don't think they're drug seeking. You really listen, and when a child feels better, they smile, they give you a high five. You could almost see a child with a fever, and when the fever breaks, you can see it in their disposition and their behavior. They're just more playful, more interactive, and they smile, bye, thank you. So even it doesn't come with any monetary value, but it's still a reassuring, valuable aspect of the practice that kind of made me gravitate towards pediatrics.
You mentioned such a valid point. Even with children determining pain and being able to express that, do you think that some children have trouble with even determining if they're in pain and expressing it, whether it's at a school with a school nurse or home with parents or with the doctor? Do you think that sometimes children have a difficulty identifying if they're even in pain and then expressing it?
Well, pain, if it's physical pain, even if a child can't express it, just observing. I've seen a child who necessarily can't express the pain, but a lot of times the mom would notice, hey, I just noticed he's limping today. And, he was just running to the playground and he's limping. And that's the one thing I was just like, well, that's definitely worth evaluating. The child, then you could ask the child, hey, does your leg hurt? And then he goes, yeah. The one part where that could play a role, where that could affect things negatively is when sometimes children could also over exaggerate. I've seen the child saying that they have a tummy pain, everywhere hurts. So from that, and it's hard to, that's when you over exaggerate. So I always kind of, one thing key in pediatrics, I always listen to a mom. I only see their child in one time space. So if a mom brings in her child and tells me, he's just not the same, the child may appear fine for me, knows her child.
When I'm around children and ever I hear that they say they're in pain, I'm actually happy to hear them express that. Now more than ever, I hear that a lot of kids are saying they have headaches. And when I was growing up, I used to feel like headaches was like an adult problem. Like, I don't know why. I just always felt like adults only get headaches. But more and more now when I'm around children in certain atmospheres, I often hear children say they have headaches or their head keep hurting. And I don't know, maybe it's just is the age, or just how I was brought up in this and what I experienced in my immediate space. But it's difficult to even confirm if someone have a headache. So even when children say that, I think even me being transparent, I think not, I have been dismissive, but I just never thought that children would get headaches, me being ignorant towards that. And now I pay a lot more attention because children can feel adult pain as well. A headache is an adult pain, right?
No, children definitely could pick up headaches. I've managed migraines So the one thing I would break up in pediatric is there's like four subsets, I guess. You have, well, if you have your newborn period, your newborn again. So, and then I have my infant and toddler, I have my child, and I have my adolescents. Of course, my infant and toddlers and newborns is hard to determine headaches from that group. Children definitely, when I'm talking my 5-year-old, 6-year-old, 7-year-old, could definitely tell me if their head hurts, and adolescents definitely so. But in this short group of children, they have what we call abdominal migraine. So they may have headache history in the family, but they complain more of abdominal pain. And then as they grow into young, preteens and teens, that abdominal migraines, then becomes true migraine history. So those are the things you could see how the pain transitions, but it all fits under migraine and headaches. And it's, if ultimately we can, figure out an organic cause of the pain, a lot of the times if we could ultimately say the child is in pain, we still go ahead and give a trial of Motrin to see Motrin or this ibuprofen or Tylenol to see how well the child responds to it. And I'm not opposed to that. If I've examined the child said they're in pain, I can't pinpoint where it is. I tell just to abort the pain, we go ahead and just say, hey, let's just give him Motrin and see what it'll do. It will help. But in a lot of the cases, the child can report, headache, if their head hurts. And
Yeah.
if you examine, there's no physical trauma to it, then I'm like, maybe he's just having a headache.
And talking about children and different milestones being met,
Uh,
and like, what are
yeah,
the age?
that is like the bread and butter of pediatric is those milestones, because they're like the gatekeepers of development. Early on, there's something as from the newborn period, as simple as maintaining eye contact, turning to noise is critical, and to let us know brain development for the first 6 months of life, like nearly 80 to 90% of the brain has been already developed. So these milestones are key, that if a child is not, from that newborn period before they hit a toddler, is not pulling to stand, is not responding to their name, not trying to feed himself, hold the bottle. These are critical. And then as the child becomes a toddler and is walking, we monitor how is this gait steady? Is the child tripping a lot? And then from there when the toddler becomes a child, language, is the child putting words together? Are they able to express themselves? The one thing you notice is a 4-year-old should be able to tell stories, should be able to ask questions more from like a 3-part. Where are you? I don't, I'm all done. I want more. These are things we expect to see in a 4-year-old, 5-year-old. And then when they become preteens, that's when they developmentally, yes. And then they start to look for peer influence, and that's when parents they talk back, they're talking to me, they start looking more for acceptance, that's trying to figure out what group that they're in, and start to rely more on their peers at that preteen. And that's when the battle of I'm independent, I know it all, I'm immortal, those are the teenage years. So these are things you see. Yeah.
I want to get my own apartment.
These are things you see in those kids where they feel they know it all, and they're eager, they could do it all by themselves. That's what we see at that age group.
Have you ever experienced the disconnect between parents and children when it comes to the children being in pain, or physical, or the parents actually understanding what's happening with the children? Have you experienced that, where the children is, they're saying one thing and the parents are saying another thing, and it's just a disconnect?
Certainly. Now, when you say pain, I just want to describe, are we talking about physical pain or emotional pain?
I'm so glad that
who is.
Yeah, thank you that's why you're the doctor. That's why you are the doctor. Well, and so I'm glad that you specified that, because, having this discussion, it can be physical or emotional pain, and that's a valid point.
Right.
Emotional, emotional pain.
Okay, so I've had a lot of times, parents have challenges understanding emotional pain, but I'd also in order to give them their fair shake, a lot of times the child doesn't open up, and the child is it's guarded. I've had children come into my office. After there's a part of the interview where we do heads assessment, we check for safety. We ask the child emotionally how they're feeling, what their goals are. D is any drug exposure. S is suicidality versus STI history. And of course, H, the beginning of the heads, is home. How is it in the home? So when I have the parents give me that 2 or 3 minutes, we start these interviews as early as 9 years old. We start to really see that's when the emotional decisions making and how the child can really assess their environment. And then I've had children come in where I had two siblings. The mom thought it was all right. When I interviewed them, it turns out the mom was in an abusive relationship, but the daughter, true and true, hated her mom or was disappointed in her mom for staying with their dad, and didn't really tell the mom, but always had an attitude. And the mom didn't know why. And then the son himself don't listen, goes in and out the house. And he's like, no, we live in this situation and our mom is here. And my dad comes in drunk all the time, however he wants. And he stays in the basement. And sometimes we think he sneaks in girls. And I'm just mad. My mom just sits through this. And this was how they were feeling. But they don't know how to give this emotion to their mom, but they just grew more distant and they acted out.
Wow.
So I kind of expressed some of it to the mom and maintain confidentiality, but I expressed some of it to the mom, and she broke down and she's telling me, what can I do? I don't work. I came into this. Ultimately, I sent them, referred them to family counseling. But these are things where, I've had those moments where a parent could feel like they know it all about their kid, their child. And there's a lot of layers there that the abusive layers, or where the child just being an onlooker, lets them know who they want to be as they grow up or who they don't want to be. And they also grow detached from their parents. I've had a child who opened up to me, came out to me in the room, but it goes, oh, don't tell my mom. I was like, I'll never take this opportunity. I can't take that away from you, from
Right.
opening up to your parents, and I'll do it. That's very selfish. I was like, I just want to make sure that I'm here whenever you need kind of to talk more. Of course, the mom asked me, I was like, this is a conversation I would leave for you to talk with him for that time
Right.
point. But I've had those conversations, where they confide
Amazing.
in me.
That
Huh? Yeah. Yeah.
amazing. Just because even with professionals and doctors and individuals with different specialties, sometimes, unfortunately, I have experienced going to doctors and them lacking, I think, a big thing called empathy. And as I listen to you speak, clearly, you're taking care of your patients, these children, with empathy, and confidentiality. And I think that is also very, very important to hear. What are some things that families or parents can do to help improve their children's physical health?
Their child's physical health. I
That's a
think it
that's a
starts
broad
really.
question because there's different nuances, and obviously, if you're listening, I always say social media and the web is good, but always make sure you set your appointment with your primary care doctor. All right, so we're not going to say Dr. Ego
Sure.
said this, but this is just a general, you know, insight. What are some things that parents can
No,
do to help physical health?
physical health. I think in just modern America, I'm a first generation. I'm a Nigerian immigrant, and when I came here from Nigeria, I think this country really has endless resources as far as food goes. And one of the things, surprisingly, in certain ethnicities is that health is related to just, I guess, eating a lot. I was gonna say dieting, but dieting is always misconstrued as eating healthy, but not necessarily. What I mean by that is physical health. We started, during Michelle Obama was pushing this campaign on healthy food choices because obesity has become a very critical problem here. And adult diseases we start seeing in pediatric, and I feel like a lot of diseases in adults tend to develop from the pediatric standpoint. I've had a mom who I really pushed because her child had high cholesterol, high triglycerides, has hypertension. I've done multiple visits, referred to the GI, nutritionist, consult on exercise. The mom got fed up and said, our people, we're big. We're supposed to be big. I told her, there's a cholesterol medication we use for adults. We don't necessarily use it in pediatrics. She was like, what I'm tired of doing is just give it to him then. Let him eat what he wants. Give it. And that's a parent who's kind of, I told her I was trying to prevent adult
Right.
problems for her child later on, but she didn't, she wasn't as receptive. So for parents, what I feel like they can do is to take control that this is a real problem. Eating to eat whatever. So I think you take control of that as a child. You could kind of set a good trailblazer, a good example for your child. Parents don't, their child don't eat vegetables. We introduce vegetables at 6 months, and they push, oh, he doesn't like vegetables. And then at 4 years of age, this kid has constipation. Like, does he eat vegetables? No, he never liked it. And then the kid is 11 years old, and he's now relatively obese, high weight, but
Yeah,
he never introduced that example. I think that's nothing's wrong with that, but to use that and that information, and also listening to your pediatrician and seeing the objective results of us as far as those lab works, and kind of, I always tell parents, don't cut out anything. End of the day, these are children. Don't put them on any diet, don't cut out anything, but we could certainly cut down. Right?
Mhm.
I was like, from my country, we eat a lot of rice. Rice is very much carbs. We could just have a whole plate of rice and meat. So I tell them, you could cut down the rice,
Rice
introduce
is
some
so
vegetables every now and
important.
then, because our plates were literally, yeah, introduce it. And culturally, we don't eat a lot of vegetables. Just we eat a lot of starchy, carby food and
Right.
fried plantain, which is just great. So those are things we start to. I always tell the parents, try to keep the plate more colorful. And so, but it all really starts in that pediatric population to set those good examples.
Yeah.
So you can only be as successful as the parent is willing to let you to be, or as concern as the parent. If the parent is not touched on the topic, because then it's going to become kind of beating a dead horse, and then it makes the visit just poor.
Another thing I want to mention briefly, I know we're going to wrap up shortly, is the idea that when parents say, he doesn't like that, or, this, or I tried to give it to him, he doesn't want it, he doesn't eat that. Um, so for me, it's a disconnect for me because I guess I didn't have the option to really tell my
Mhm.
parents what I don't and what I do like. And I think there's a pro and con to that because we are in a space where we want children to be independent and we want
Yeah.
children to be able to have a voice. We want to give them that option. But I think there is a line that it's difficult for parents. When do you want them to express and be themselves and have those options when dressing or eating food? Because sometimes children just say they don't like something because of how it looks. And this idea of they don't like it, she's not going to eat that. It also empowers the children to perpetuate behavior that they have whenever they don't like something. If I show her that I don't like this, she's gonna back off and not give it to me because she know how I'm gonna act when I don't like this. So if it is something that is nutritional or something that is good for them, I know this is touchy for the parents, but this is just shut up and talk up wellness lifestyle branding. We like to keep it real. Um,
Okay.
but do you understand where I'm coming from? Like it's a
I
gray
do.
line, and it's saying they don't
I
like it.
think I think in this time, every parent wants to be that ideal parent. Gone are the days where it's just you run your house like a military lieutenant, where I just because I said so. Now with social media playing a part, every child wants their voice heard, and parents are like walking on eggshells to be the best or the better parent, because years down the line you don't want your child to pull these receipts out. Oh, remember you did this, you did that, you did this, you did that. So, but I do feel we are empowering our children at a very young age, And not to say to not listen or not to open up to them. It's to always kind of explore the reasons for how they feel. That allows, sometimes I've had children refuse something in the office and I just dig deeper. And then as we dig deeper, I told her, so does that make any sense? So then they're like, no, it really, I don't know. Then the child's just like, see, I'm on your side. Like, that's why I think this is better. But I just want to know why you feel how you feel. And then
Probate
that's really,
question.
I try to guide them because ultimately I'm already at that end point and I know them refusing is not valid. Maybe I don't know why they're refusing, or so I try to figure out why. So then
Right.
when I bring my own reasons why I don't think it's valid, then it all connects and we meet at the same place. Like, all right, I'll give it a try. This isn't in my discussion as far as weight, some children, and that's why I always tell them I don't want you to feel like, I don't. And I always say, if again, I'm going to touch on weight and obesity. I always tell the parent two things. Stop saying she eats this, she does this, she does this. Don't buy food for the whole family and leave her to eat greens like a horse. Everybody as a family have to participate in this because she doesn't have a problem. The family has a problem. All right. I was like, the family has a clear
And it
problem
may
here.
not be
So I
visible in
always never
all the
say,
children. I'm sorry, I apologize.
yes.
It may not be
No,
visible
you're
in all of the children, but just because let's say diabetes, it may not be vigilant in all the children at the same time, but when the siblings grow up, it may appear later. Each
exactly.
sibling may get it at different times. And you're right, it's a family thing.
I always never single anyone out, but I think every child has the true and true. As parents, we shouldn't enable, but I think we can open up a conversation more because children will run to social media and children compare their life with other children's lives, and that's where they're gonna get empowered from. And every parent wants to be, and there's no manual being the best parent. All you can do is try to come from a sensible place where your child isn't, because you as a parent, you're older, wisdom, true and true comes with age. So you can help them guide all of these external influences that's coming, because that's what's going to guide them make their decisions. And as a parent, you have to figure out which one is valid. Some of them you are going to encourage your son or daughter to make them feel empowered. You're right, that's true, that's true. This isn't, that isn't, that isn't. And that's how you empower them to speak up more. But don't just discredit or diminish their emotions or anything again, like we used to when we were growing up, as because I said no, because I said no.
Yeah,
That's
because
just
I
how you
pay the
kind of,
bills.
yes. That a child like I've had a child walk out the house because of that. Well, if you're under my roof, I better, but you're gonna have to go. And then the child said, you know what? Boom. Then come home in 2, 3 days. And the reason is because now he feels like, it's this tug of war between,
It,
well, just because you pay the roof, you pay the bills, you think you're gonna control me.
right.
It's
And
teenage.
it's yeah, it's a lot of layers and nuances with it as well. Even with parents and children, and when it comes to way of life, the food you eat, the generation, the technology, there's so many different nuances. And I think that balance is important because I'm an old school gal, and I stand firm on a lot of old school
Like
teaching.
myself.
But I also understand that in order for us as a society to move forward, and starting with the children, with the baby, that's why I'm speaking to you, the pediatrician, we have to find a balance. There has to be a balance. And so, rather us trying some vegetables or fruits with the child and they saying, I don't like it, and we just say, oh, they don't like it. It's like,
Yeah.
show
It's gonna
children
be
like, look, there are things that mommy eats that mommy may not want to eat all the time. But I know that I need this for my brain. I know I need this for my heart. And hey, you don't have to eat it all the
that's
time.
exactly.
How about once a week? All right?
That's how I
Pinch it out.
that's how I talk to them. Yeah. I'm like, if you do well this whole week, on Friday, you pick what you want to eat. And the kid's like, really? Like, you pick wherever, but you got to go. And then they stay on schedule. That's usually how I go about it. But
Routine.
we're in a day and age, you have to kind of do these things with your child just because just the way we rear is different. Again, it's a lot of more social influences of now than
Yeah.
ever.
What are some of the major, I want to say health complications that's affecting um, children right now? Like top, is obesity one of them? Or,
Um, I would
and
say,
that's a large, that's a wide question. So, I mean,
I think from
for people
a lot of the standpoint, on a physical arm, it is obesity because that becomes like the umbrella for a lot of other health issues for children going forward. Any child with, asthma, obesity worsens asthma, obesity worsens high blood, obesity worsens a lot. So I think obesity is on the top. The second part about it is now where we're, I guess sexuality, for lack of a better way to put it. Children are it's what I mean by that is from an earlier age they're having more identification problems. I'm seeing it more than I did growing up. Whereas if it's gender, trans and binary, conforming, non-gender, these are the things that I'm seeing more, and a lot of that just the child not knowing who he or she may identify with creates a
right.
lot of anxiety, depression. So I see a lot of children on the emotional aspect or the psych
Wow.
aspect. I'm seeing that more, which leads to I've managed in ER. I've managed in the ER a lot of suicide. I mean, I've had a suicidality. This child who's suicidal at 9, suicidal at 12. These are things we see real problems that has layers that comes from social acceptance. So that's the one part. Social acceptance, being in an in crowd, being acceptable, having a circle is becoming very important for children. And that has led to a lot of psychological, emotional harm. So that's a big problem in pediatrics. The other arm is obesity.
Right. That's why we need doctors like you, and we need to share this information to our audience. Primarily, our audience are men and women between the ages of 25 to 45, and they have children. Some of them have children, some of them don't. Children are around, and that's one of the reasons why we thought that it would be so purposeful to have a conversation with you. I want to thank you so much for sharing. We had an amazing
You're welcome.
conversation. So many jewels that was dropped today. Before you go, can you let our audience know where they can find you, if you have any products, any services, or anything that you want to share with our audience?
As I mentioned, for those in the DMV, my pediatric practice is in Greenbelt, Maryland. It's Edge Pediatrics.
Oh,
We're
okay.
online. Yeah, we're online, edgepediatrics.com. And of course, if any questions, these aren't, I'll always preface with, use my, whatever we discuss, if it's medical information, use that in tandem with what your child's pediatrician goes with. But my social media handle is at Lego My Ego. That's EDGO _. Yeah. And I'm sure you guys, you could put it in there as well,
Branding,
in the
by the
caption
way.
somewhere. Thank you.
Very branding,
Thank
by
you.
the way, definitely. And do you have any products or anything you want?
Uh, right now, no, but I am working on something. But it's right now it hasn't been able for like mass market production yet.
Okay, all right, that's fine. Well, ladies and gentlemen, we definitely, by the time you guys get this video, we will have the links and all the information where you can find Dr. Ego. Once again, this is the Shut Up and Talk About Wellness Lifestyle brand. You're listening to the Health Talk discussion, and it's been an honor to have you here today, Dr. Ego. Thank you so much.